Taraba State, Nigeria, a region plagued by a silent epidemic that threatens the lives of mothers and their unborn children. The 2018 National HIV and AIDS Impact Survey revealed alarming numbers. 8.1% of Nigerians live with hepatitis B and 1.1% with hepatitis C. Taraba State faces a prevalence rate of 19% for hepatitis B and 11% for hepatitis C. Additionally, syphilis, a common sexually transmitted infection, affects millions of lives worldwide. In the heart of Taraba State, the Center for Initiative Development partnered with the TY Danjuma Foundation to take a stand against this formidable threat and improve maternal and child health care by preventing mother-to-child transmission of viral hepatitis B and C.
My name is Danjuma Ada. I am the Executive Director of Center for Initiative and Development, a community-focused organization based in Jalingo with head office here. CFID is a patient-driven, community-focused organization that tries to improve access to care, especially for vulnerable and underprivileged communities.
The Center for Initiative Development's office is a hub of activity. Here, a dedicated team works tirelessly to implement their vision of preventing mother-to-child transmission through testing and treatment of hepatitis. Meetings and strategic discussions are held regularly, ensuring that Center for Initiative Development stays on track to achieve its goals. Center for Initiative Development knows that prevention effort requires the support and collaboration of key stakeholders. They regularly organize advocacy meetings and engagements to raise awareness and rally support.
We are privileged to have the TY Danjuma Foundation as probably one of the first indigenous institutions that provide services to improve communities or populations' access to hepatitis B prevention and then birth dose vaccine in hard-to-reach and underserved communities of Sardauna local government.
The project sets out to strengthen healthcare infrastructure in Taraba State by procuring essential test kits and consumables needed for routine screenings.
So the mother goes to that antenatal, she gets HIV test free, and she's asked to go to the laboratory or to go outside the hospital to get hepatitis testing or syphilis testing, which she has to pay out of pocket. That is a big barrier. And yet, the diseases have similar mode of transmission: vertical, mother to child, sexual transmission, right? And early childhood transmission. So why would the woman not get all these services in one place where she attends antenatal? And that is why, from the privileged position where I am as the president of WHA, with that knowledge and with that understanding, and also working with WHO at the global level, we reached out to the TY Danjuma Foundation to see the need to incorporate hepatitis B PMTCT in the context of maternal and child health. And I'm super excited and happy to say that this grant was approved globally. Even, in fact, data have shown that 25% of children who get hepatitis B at birth will go on to develop liver cirrhosis. After this 25%, about 50% may die of liver cancer. So, and all this could be avoided if these pregnant women are tested and provided services, and these babies are given the vaccine at birth. So the motivation is, how do we mitigate this big hydra-headed monster?
The scheme maps out and identifies public and private health facilities, including traditional birth attendants, ensuring comprehensive coverage across the region.
The project supports us to train healthcare providers on how to deliver stigma-free and quality care for women attending antenatal. And in this context, we're looking at what is called triple elimination of HIV, hepatitis B, and syphilis. Now, this is a new approach by the World Health Organization to provide people-centered care to at-risk populations. So with the support of the foundation, we train healthcare providers at the level of secondary and primary levels of care in Sardauna local government.
Also, the project recognizes the critical role traditional birth attendants play in the community. They provide mentorship and training to empower traditional birth attendants in supporting maternal and child health. The traditional birth attendants undergo intensive training, equipping them with the knowledge and kits needed to ensure safe pregnancies and deliveries.
We train them also to refer pregnant women who they provide services to at the community, so that they also have the knowledge and the competencies to provide these services.
Center for Initiative Development's efforts reach a crucial stage as they conduct routine screenings for HIV, syphilis, hepatitis B and C.
They receive free screening for hepatitis B and C. They receive information and healthcare education on prevention of hepatitis B and C, and also train them on how to deliver quality HIV screening and syphilis training, so that the woman who comes for antenatal is able to receive a complete package of care that will address these three diseases of HIV, hepatitis B, and syphilis.
Pregnant women, women of childbearing age, and husbands and male partners all receive screenings and necessary treatments, bringing hope and relief to thousands.
So it's a comprehensive package indeed that will help the pregnant women and also help the healthcare providers provide services in line with current guidelines of the WHO and also the national guidelines of the Federal Ministry of Health.
The tireless efforts in this partnership with Center for Initiative Development yielded remarkable results. As the project continues, the future of Taraba State looks brighter. Center for Initiative Development's commitment to preventing mother-to-child transmission of HIV, syphilis, and hepatitis B virus has saved countless lives and transformed communities. With continued support, the journey toward a healthier tomorrow continues.
So as CFID, we are thrilled to get that support from the foundation, and we're so happy to say that the project is really impacting on the lives of vulnerable populations and hard-to-reach groups on the Mambila Plateau in Sardauna local government area.